Good morning, good people. It is a beautiful, blustery fall day here. We've had a nice, lovely, gentle rain all day. I've got a cup of tea for Coffee Friday. And I would like to continue our conversation about breech and what choices you get to make with a breech birth. Um, so, first of all, if anyone tells you that you don't have a choice about how your birth is going to go, they're wrong. You, of course, have a choice about how you want to birth your baby. And if you have a partner or a spouse, um, they also get to be involved in this decision. Your provider, whether it's a midwife or an OB or whomever that's supporting you, they're there to facilitate your desires and your wishes. Um, do not discount their expertise, however, okay? But you get to make the decision that feels good to you and feels safe to you and feels true to your heart and true to your baby's heart. Um, so, with the choices, I'm going to say it: vaginal breech birth. It's doable. It's totally doable. And with the right practitioner and a good baby position and your confidence and a partner who's not afraid of what's happening, vaginal breech birth is 1,000% possible. It's important that you do your research. And I talked about that last Friday. Places to look for good evidence-based, science-based information about vaginal breech birth. I personally do believe that with vaginal breech birth, it is very important to have a skilled practitioner there. Because even if everything is lined up like super duper and baby's in a great position and everything's been healthy, there still can be complications from a vaginal breech birth. And it's important to know that, and it's important to know what those complications are. For a lot of babies born breech, there will be some respiratory distress once they come out of the vagina. And so you want somebody who is skilled and knowledgeable about helping to promote good breath for the baby after they're born. Okay. And you also want somebody there who knows how to take care of you, the birthing parent, after you have a vaginal breech birth. So you get to decide. And if vaginal breech birth is not right for you, that's okay too. Then you plan for a surgical birth. And there's absolutely nothing wrong with having a surgical birth. There's no shame about it. You get to decide what is best for you. With a surgical birth, you still get to make a birth plan. You still get to make decisions about how your vision goes for that birth. You don't need to be knocked out and have that baby surgically birthed and then not know what happens. Like, that's not okay. When we give birth, we're bringing a brand new person, a brand new spirit into this world, and you get to participate in that. So when making these choices, I have found in my experience, it's a really good idea to make a list of pros and cons. Like, why would we want to Pick either one, okay? Um, you also get to go through the BRAIN acronym. And I'll make a little thingy, animation thingy with the BRAIN acronym. But real quick, what it stands for is benefits, risks, alternatives, intuition, next, and nothing. It's a brain with two N's. It's cool. Um, it's an acronym that, not only can be used in the situation of pregnancy, labor, and birth, but pretty much any situation in life. It's a good thing to refer to. Anybody who tells you there are no risks to a surgical birth, I would encourage you to stand up and turn around and walk out of their office, because they don't know what they're talking about then. There are risks. There are risks with vaginal birth. There are risks with surgical birth, whether the baby is breech or not. So find out what they are. Find out if that risk feels okay to you. Make sure that when you are looking into these choices, that you're working with people who are giving you evidence-based information and not opinion, because we all have opinions, and some of us have very strong opinions about what breech can look like. So discern what an opinion versus evidence is for yourself. It's really important. It's important to me as a provider to empower you as a person to be able to have the birth that feels best to you. Okay. Enjoy this beautiful blustery day if you're up here in the Midwest. And stay warm, stay dry, stay cozy. Look forward to talking with you all next week. Thank you.